Welcome to Aesthetic TV. I'm Stuart Brazell, coming to you live from the stage of the Aesthetic Show. While liposuction can remove fat from specific areas on the body, aesthetic specialists are seeing a new generation of treatments and procedures targeted towards the growing population of people looking for non-surgical solutions. The CoolSculpting procedure by ZELTIQ is the #1 most requested non-surgical body sculpting procedure worldwide, according to the American Society of Dermatologic Surgeons. That's because this revolutionary medical device provides a new paradigm of fat reduction, appealing to a very large potential patient population who are looking for non-surgical body sculpting. In fact, an estimated 22 million aesthetically oriented patients are interested in CoolSculpting for that very reason. With me today to discuss CoolSculpting fat reduction is Dr. Anil Rajani, a Portland, Oregon-based leader in minimally invasive aesthetic medicine. Welcome, Dr. Rajani.
Thank you, Stuart. It's great to be here.
Okay, so what is all the buzz about CoolSculpting?
Effective body contouring and fat reduction procedures are like the holy grail of medical aesthetics, especially if you can do them non-surgically. And most aesthetic patients are looking for non-surgical procedures. The CoolSculpting procedure is FDA cleared and offers a unique and proven technology that has been embraced by physicians and patients alike. In addition, CoolSculpting has been shown to be safe and effective in reducing fat in over 50 clinical studies. I see this as a very hot technology.
I love this. So for a procedure that is considered so hot, doesn't CoolSculpting actually freeze fat as part of the treatment?
CoolSculpting uses cryolipolysis to freeze and destroy fat cells. It's designed for treating multiple body areas such as the love handles, the abdomen, and both inner and outer thighs. It's a simple procedure that's virtually painless and with no downtime.
Is that all that separates the CoolSculpting procedure from the other fat reduction and body sculpting devices on the market?
There's so much more than that. Clinical studies of CoolSculpting report that on average, a patient will lose 20 to 25% of the fat with each treatment. It works great on inner thighs and the saddlebags. This system has been a great addition to my practice.
And how does, I'm hoping I'm saying this right, cryolipolysis work exactly?
It is a mouthful, Stuart. It utilizes non-invasive cooling of adipose tissue to induce lipolysis, or the breaking down of fat cells to reduce body fat without damage to other tissues and structures. The cooling energy causes fat cell apoptosis, a natural controlled death which leads to release of cytokines and other inflammatory mediators that gradually eliminate the affected cells. Over time, this reduces the thickness of the fat layer. Lipids from the targeted fat cells are gradually released and eliminated from the body by way of the lymphatic system. For me, it's the best invention in the aesthetic field in the past 5 years.
Yes, and millions of CoolSculpting cycles have been performed globally, which gives you some idea of its popularity.
Within my own practice, we have 2 units and plan to purchase 1 to 2 in the coming weeks.
So in other words, the market for this type of procedure is big and getting bigger?
Exactly. It's no surprise that CoolSculpting is rapidly becoming a gateway procedure for new aesthetic patients. Existing patients love the procedure, but if physicians are interested in capturing new patients, then it's clear that offering CoolSculpting is the way to achieve practice growth.
The device also comes with several applicators for different body areas. So what are these different applicators and how do they work?
Most of the applicators utilize suction to hold target tissue in place while applying the cooling. For the abdomen, treatments are often performed with the Cool Core applicator or the Cool Max applicator. There's also the Cool Curve Plus applicator, which fits on and around the curves of the body, such as the love handles or the flanks. Cool Fit is a flat applicator that works on vertical fat in hard to treat areas like the inner thigh. Cool Smooth Pro is a surface applicator that works with non-pinchable fat, such as on the outer thigh. ZELTIQ is also anticipated to release another applicator called the Cool Mini, and it looks very promising.
I love the name. And in addition, I heard recently that the FDA announced that the CoolSculpting procedure could be performed at much lower temperatures, enabling shorter treatment times.
That's right. The first of these applicators to take advantage of the colder temperatures is the CoolSmooth Pro, which treats non-pinchable fat, such as on the outer thigh, in only 75 minutes, nearly 50% shorter treatment times. That's invaluable to the practice and the patient. The CoolSmooth Pro also incorporates a strapping system that makes applying it quick and very ergonomic.
Now, all this new technology, it sounds fantastic, but isn't patient satisfaction the real reason for these millions of treatments?
CoolSculpting truly is an extremely predictable treatment, so patient satisfaction is high. It's in the 95% range, which is very high for aesthetic treatments. With that level of satisfaction, they return for additional treatments or easily refer their friends.
To help practices adopt the CoolSculpting procedure, ZELTIQ offers a comprehensive range of services and technical support, including training centers, a progressive physician loyalty program, and dedicated practice development managers, or PDMs. So, Dr. Rajani, what can you tell us about the PDMs?
Practice development managers help physicians drive increased business. The whole CoolSculpting business model encourages active participation among the PDMs, physicians, and the staff. PDMs also help determine overall practice trends, so it's very hands-on and a win-win partnership.
With the CoolSculpting procedure, the wow factor comes into play with CoolConnect, a platform that analyzes CoolSculpting activity within a practice in real time, and with CSU, CoolSculpting University. So, Dr. Rajani, what is involved when practices utilize these programs?
These training programs teach CoolSculpting operators how to create optimal treatment plans for patients, as well as guide staff on what applicators should be used on different body areas, and more importantly, how to place the applicators on the body.
And can you explain CoolConnect?
CoolConnect is a unique business intelligence platform integrated into each CoolSculpting system. It empowers physicians to make smarter, data-driven decisions about their CoolSculpting practice. For example, from understanding your practice's treatment trends, you can develop target marketing strategies. It's an amazing technology. As you start to see trends, your PDM also steps in to really help you evaluate how well the business is doing.
Now, CoolConnect, this sounds like a very unique and valuable service. What else does ZELTIQ offer?
Not only that, but ZELTIQ's Cool Assurance warranty program protects both the system's reliability and the practice's CoolSculpting business. Compared to most warranty programs, which often exceed $10,000 per system, Cool Assurance is very affordably priced at $5,000 for up to 10 devices.
Well, thank you, Dr. Rajani, for giving us the inside story on this amazing procedure, technology, and company. Let's take a quick break, and when we come back, Dr. Rajani will assess a lucky CoolSculpting patient volunteer. We've asked Daniel to join us on stage for a CoolSculpting consultation. Welcome to Aesthetic TV.
Thank you, Stuart.
Okay, so what treatment do you recommend for Daniel?
Well, I talked to Daniel earlier, and there's a couple areas of stubborn fat that he just can't get rid of. So we've decided to place a large applicator like this on the lower abdominal region, and then place two smaller ones on the sides to get those stubborn love handles.
How comfortable will this be for him, and what can he expect?
It's a very comfortable procedure. In the beginning, he's going to feel a cold sensation for about 10 minutes. That's going to go away, the area will be numb, and then he can get on the internet, watch TV. It's very comfortable, and the whole thing only takes about 1 hour.
That's really impressive. Now, what about follow-up treatments?
Yeah, so what we're going to do is we're going to see Daniel back at about 30 days, just to see how he's doing. And then we're going to see him back at 3 months, where we're going to take pictures so we can see that definite result. At that point, we'll ask him if he wants further fat removed to really sculpt that area, provide a wow result.
Well, Daniel, I'm excited for you. I would like to thank Dr. Rajani for providing a fascinating look at CoolSculpting by ZELTIQ. And thank you, Daniel, for joining us today to help show the audience how this technology works. For Aesthetic TV, I'm Stuart Brazell. Stay tuned.
And stay beautiful.